Modibanji, Malawi, and very happy to be with you today for our first health media training we do in Malawi in 2023. This is really very important for us. We do this health media training in partnership with First Lady of Malawi and my dear sister and ambassador of Merck Foundation, More Than a Mother campaign. Her Excellency Mrs. Monica Shakwira, and I'm very glad that we are working closely together, and we have done great things in very short time, knowing that we know each other, as you know, during Corona, and we met online. We started our programs, and in a very short time we have introduced a lot of programs that is close to my heart and to her heart, and this was the Educating Linda program. We have provided scholarships for 40 girls in Malawi to complete their education, and it's very much important because this is to empower them to reach their potential and fulfill their dreams. And of course, not only that, but you know how many scholarships we have provided till today. In a very short time, it is 33 scholarships to young Malawian doctors in 32 critical and underserved specialties. Most importantly, fertility, embryology, sexual and reproductive care, diabetes, cardiovascular preventive, respiratory care, acute care, and endocrinology, and oncology, and there is extension for more specialties like pediatric, internal medicine. Also, we have in internal medicine, we have in pediatric emergency and advanced surgery, and many other specialties that are going to be introduced also to transform public healthcare sectors. Together with Her Excellency, the First Lady of Malawi, Ministry of Health of Malawi, we had made a transformation in public healthcare sector, and we also made history. But also the awards, the 8 awards that we announced last year and year before, and this year as well, it will be about More Than a Mother Awards, Fashion Award, Media Recognition Award, Film Awards, and Song Awards. And these awards to you to address, and through your work and through the media coverage, either online or TV or radio or print, how to empower infertile women, how to break infertility stigma, how to sensitize the communities about raising awareness about male infertility, knowing that the cause of infertility is 50% for women, 50% for men, caused by men. So why then women are the only one to be blamed for delay of having a child? Merck Foundation have done our Africa TV show. We are looking forward to broadcast it in Malawian TV as well, so you can enjoy it. We are in the way to talk to people about this. But this TV show address all these topics through fashion and art with purpose from across Africa.
Senator Dr. Rasha Kelej, and creator of our Africa TV show.
All Africa will be part of our show.
The CEO of Merck Foundation.
We want to support girls' education. No to infertility stigma, yes to girls' education. We want to stop gender-based violence, for stop. Number of child marriage will double by 2050.
Good morning, everyone. As rightly said, I am Dr. Martha Masamba from the University of Kamuzu University of Health Sciences. I'll take you through a talk entitled Infertility Prevention, and also looking at the link between infertility and infectious diseases. And we will talk about male infertility. As we know, we can't talk about fertility without the involvement of men. So I'll take you through some key take-home messages from this talk. Number one, infertility is not a stigma. We should really raise awareness that people that are suffering from infertility should not be stigmatized against. Yeah, so the other point, the other take-home message is that infertility affects men and women equally, and so the blame should not be left to the women alone. People need the information. We can talk about all this, but if this information is not taken across to the communities, then the stigma is going to continue. The women will continue to be stigmatized regardless of the causes of the infertility. So men need to be advised and encouraged to support their partners when they are seeking fertility care. Fertility is a shared responsibility. And we know that it takes a man and a woman to have a child, and therefore this is not just the woman's responsibility. Importantly, it's to realize that we are human beings, whether we have children or not. Men are more than fathers, and women are more than mothers. They should be accepted as such.
So I thank the Merck Foundation for giving me this platform today to shed some light on the following topics that Alisha already mentioned. And I'm Dr. Janita Nyamar, and Dr. Martha already shared some valuable information about the links between infertility and infectious diseases. So what is the role of the media in all this? The media are part of our lives and have a large influence on our society. The importance of media is increasing every day due to the great connectivity that exists all over the world. It is the media that can influence our society to create a cultural change. Just as we experienced the recent pandemic where all the information was passed on to the public, the media has an important role to play in breaking the stigma of infertility and helping. As I was saying that just we have experienced the COVID pandemic recently, and the media had a great role in sharing the information, how to use, what to do, what not to do, and how to cope in this condition. For stigma also and infertility, the media has a great role in prevention of these. The media can also promote self-actualization, which is the full realization of one's potential and the full development of one's ability and appreciation of life. The role of the media is also to raise awareness of laws relating to the protection of women against domestic violence, sexual harassment, professional harassment, and mental harassment. The community itself does not have adequate knowledge of infertility and other social issues. It is the media that can raise awareness of these issues and make them understand that infertility affects both the partners, provide them with the correct information, and encourage them to seek help.
Merck Foundation. No more diabetes, reverse diabetes, goodbye diabetes. We can make it work, can make it work, can make it work, can make it work. Push back diabetes, no more diabetes, reverse it, can make it work, can make it work, can make it work, can make it work. Can do anything we put the mind to. The body exercise and put the smoke in. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Let our choices every day will make the difference. Exercise every day to make the difference. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Choose a better day plan. Hang with the smoking. Say no more alcohol, no. Exercise every day. This fight is global, this enemy is vicious, but we can defeat it. If we make the choice, we can make it work. If we make the choice, we can make it work. Can do anything we put the mind to. Put the body exercise and put the smoke in. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Let our choices every day will make the difference. Exercise every day to make the difference. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Choose a better day plan. Hang with the smoking. Say no more alcohol, no. Exercise every day.
Thank you very much for this opportunity. First and foremost, I would like to acknowledge Her Excellency, the First Lady of the Republic of Malawi, who is also the ambassador of Merck Foundation More Than a Mother campaign and Media Council of Malawi, Ms. Monica Chakwera, and the CEO of Merck Foundation, Senator Dr. Rasha Kelej, all protocol observed. I will highlight an overview on the topics: promoting a healthy lifestyle, raising awareness about prevention and early detection of diabetes and hypertension, and how to report it to the community. This brings us to the role of the media. The media provides an important link between the disadvantaged rural populace and the provision of the vital health information. The media also helps health workers expand their audience reach, and it's also important because it plays a major role in educating the public about health concerns. Thus, it brings clarity to the information that the public will get. It is also the responsibility to report accurate health and science information to the public. The media can also play a supplemental role by being integrated into a program that includes face-to-face or other forms of intervention. The media can be used at many levels of audience, organizations such as individual, network, organizational, or societal levels.
But as we are doing our work, it is also very important to remember that these are sensitive issues, so we need to be sensitive. But as we are being sensitive, let's avoid over-censoring ourselves. We must always seek facts, present them properly, and avoid, losing facts in the course of doing our work. And let knowledge and facts lead, but avoid our emotions. We could have understood certain things based on our cultures, but we should avoid, when we are presenting them in this context, having our emotions leading the way. Let the facts, as we have gotten them from experts, be in the lead. And remember that we're dealing with people's lives here, and therefore we must always avoid hating in the way we are presenting our stories, and never be part of people that raise false hopes. There is all this talk of miracle cures and herbs. We have a role of ensuring that we are not part of those that are presenting the falsehoods and for raising false hopes. Instead, let's exchange hope and ensure that our people are well informed of how best they can get help when, for example, they've got issues around infertility, they've got diabetes, they've got high blood pressure, and so on and so forth. Because that's the only way we are going to be a saving function of society. And of course, let's remember that we're dealing with people, so confidentiality of people's situations and conditions and that of their families is very critical. Otherwise, we'll end up hating instead of helping them understand these things and therefore be able to do things right.